Disclaimer. This particular video is meant for education purpose of veterinary medical professionals. All non-medical persons can sit by and can have knowledge about clinical studies and requested not to try treatment on their own. Just consult a qualified veterinarian if your animal is diseased, as they have given their ears to treat your pet. Thank you, and just watch the video. So hey everyone, welcome to Core Vet. So today in this particular video lecture, we'll be discussing a clinical study. So this clinical study has been made by Animal Husbandry Department of the Tamil Nadu and Pathological Department of IVRI, Center for Infectious Medicine, Institute of Virology, as well as by the Madras Veterinary College. Okay, so this particular clinical study is more focused on the cases of warts, and to be more precise, this clinical study has been more focused on the canine oral papillomatosis. I'll be just sharing the link below for this particular research paper. You can just go and thoroughly study also, right? If I'll just discuss this particular condition, what is produced by what? These are produced by the papillomavirus, which is a double-stranded DNA virus, and these papillomavirus, what they tend to lead to, is a benign neoplastic proliferation. To be more specific, I'll just say that they create a neoplastic proliferation of the squamous epithelium of the body, right? And if I'll just consider, or if I'll just talk about that, this particular cases are more common in the age group of less than 4 years, okay? And this particular disease is not gender specific, means is that it's not like that canine oral papillomatosis or the cases of the warts are more common in the males rather than in the females. It's not like that. So it is not what gender specific, right? And if I'll just say what's the procedure they had made, and to be more precise, these cases are of high morbidity rather than of high mortality, right? They have very low mortality, but the morbidity in the cases of the canine, to be specific, it's quite high. Okay, let's just discuss how they had made this clinical study. So what they have done, they had created two groups, right? Out of the 16 animals, they had divided 8 animals into two groups, a group A and a group B. What they had done, that they had made a treatment, right? In the group B, they have done what? They had taken 4 homeopathic medicines, right? I'll just mentioning at the end what they are, okay? So they had taken 4 homeopathic medicine to treat these 8 animals that are there in the group B. And what they had done to the animals of the group A, they had given what? A placebo medications. What a placebo medication is that, yeah, psychologically, yeah, we are treating you, but these placebo medicines, they are not acting physiologically, right? That's what the placebo therapy means, right? They are not for the treatment. They are just psychologically telling the animal that, yeah, you are getting treated, right? That's what the placebo means. Okay, so this was about that, how the group division has been made, right? Group A was given the placebo medications, and group B has been given a combination of 4 homeopathic medications, right? And I'll be just mentioning it afterwards, right? So if I'll just show you the lesions first, what they had obtained during their studies. So you can see, you can clearly appreciate these are what? The oral papillomas, right? And after the homeopathic treatment, you won't believe, at the end I will be just discussing how much duration they had taken. Okay, so you won't believe that these oral papillomas are getting reduced to this certain extent. It's quite appreciating that the homeopathic medicines are giving that much good results, right? Because there are several practitioners that prefer other line of treatment. Likewise, several prefer vincristine sulfate also for the treatment of the papilloma, right? But it is not that much effective, as much as effective a homeopathic treatment could be, right? Because several people use different medications that are available by them, like apple cider vinegar, acyclovir, even the levamisole is also used, right? And several surgical procedures are also being made, like your surgical resection even, and the cryotherapy also. But why I am just emphasizing this homeopathic treatment, because it is quite effective, because it is pocket friendly, first of all, because looking for a treatment, the pet parent or the owner obviously look a pocket friendly treatment. That's what the homeopathic gives, obviously, right? Because the result that has been shown, it's quite effective. That's why I'm just discussing this particular clinical study, because it's quite good, right? That a pocket friendly drug can just even treat this to a certain extent, that it is quite good, right? You can see how quickly, because I will be just mentioning this particular result is just in between the 7 to 15 days, okay? Just this much, means in a fortnight this particular condition of canine oral papillomatosis has been treated well, right? So if I'll just show a histological section, even these two, the first two are of the 0th day, right, of this particular canine oral papilloma, right? These two are of the first day. You can appreciate this is on the 400x, right? And this is on the 100x of the hematoxylin staining, right? And there is a keratohyline, neovascularization, there are several things, and you can clearly appreciate after the 5th day onwards, okay? After the 5th day onwards from the homeopathic treatments, a good result has been appreciated. Likewise, in this, you can see at the 5th day onwards, there is a reduction in the keratohyline conditions in the histological section. Even the neovascularization has been reduced on the histological sections, okay? Now, if I'll just moving towards what medications were there, right? Because that's what the topic of interest, obviously, for any clinical study, that how good a result could be there after giving a certain medications, right? If I'll just mention, so what line of treatment has been given? First of all, I'll just mention that what line of treatment was given for the group A. It's nothing, it's just a distilled, wait a second, just give me a moment. It was nothing, it was what? Distilled water, because obviously it is a placebo therapy. So what they had given, a distilled water, and at the dosage of 8 drops for 5 per kg body weight, means 5 kg, okay, body weight. On the 5 kg body weight, they had given 8 drops, means if an animal is of 20 kg, they had given 40 drops of distilled water just. And for what? At the duration of 12 hours, okay, they had given this for what? 15 days, right? As in placebo therapy in the group A. And what the line of treatment has been followed in the group B in their clinical study, they had given 4 drugs, right? They had given 4 drugs. The soronium in the 30C potency, sulfur in 30C potency, graphite in 30C potency, and thuza in 30C potency. Let me just mention what effectiveness they show in the animal body or the human body only, because these drugs are used in human medicine since long time, right? And it is now used in the veterinary also. So if I'll just mention their properties, so if I'll talk about thuza, so the action of thuza is an immunomodulatory, like this particular thuja just tend to just appreciate the action of the CD8 cells, right? CD4 cells, they appreciate like that, right? If I'll just mention that thuja, it is an immunomodulator and an antiviral property also. So this thuja is effective for both the properties. And if I'll just talk about the sulfur, so sulfur is an, if I'll talk about, it is more effective in terms of healing damaged skin, right? And it is quite used in the cases of atopic dermatitis also. If I'll talk about graphite, it is a powerful anti-psoriatic agent, means in the cases of the psoriasis also, the graphite is given in the homeopathic medications. And it also prevent what? The skin eruptions. So graphite is quite good for the treatment if there is an skin eruptions also. And if I'll just talk about soronium, it is obviously, as the name suggests, it is having a good anti-psoriatic activity, right? And if I'll just say, oh, just let me tell you what is 30C over here. See, in the homeopathic medicines, it's not the mg or the milligram or the microgram. See, the unit is not like that, right? Likewise, we can just say that you have to give what amoxicillin at the rate of what 30 mg, 20 mg, or you have to give ceftriaxone at the dose rate of 15 mg per kg, like that, right? But in the case of the homeopathic medicines, what we do give the medication in terms of potency of 30C, 60C, 90C, like that, right? What the C over here is, it is centimole, right? Centesimal. It is the unit of what? The homeopathic medicine. If you are just going to just get these medicines out of the market, you have just appreciate that they are going to sell in the potency of 30C, 60C, 90C, like that. And the unit is, this C over here is what? Centesimal, right? And these 4 drugs are combined and given at the dose rate. See, the dose rate of all 4 is similar, means a true drop of soronium individually, okay, individually means you have to give soronium 2 drops per 5 kg, sulfur 2 drops per 5 kg, graphite 2 drops per 5 kg, thuja 2 drops per 5 kg, means the combination has to be given, and it has to be given what? Twice a day for at the interval of 12 hours, right? For the period of 15 days. And you won't believe the result was so good as per the clinical study or the clinical research paper that I had studied from this particular your animal husbandry department only, that the result has been observed in the from the 5th day onwards, but in all the 8 animals of the group B, the result has been obtained under the 15th day, right? Means a span of 15 days is enough for the treatment of this. If we'll talk about the prognosis, it's quite good, and no reoccurrence has been seen in the follow-up of 1 year. Okay, so what it is a good substitute for all the other treatments. Okay, it is very good substitute, right? And if I'll just talk about, there are several companies for these particular compounds like soronium, sulfur, graphite, thuja, right? And what some people do, that they give thuja alone, right? What, according to the clinical study, what I had studied, and I'll obviously share it below also, that they had given thuja alone for 2 months, right? But thuja alone for 2 months, it's not that much effective as this particular combination of 4 homeopathic drugs is. So obviously, I'll just give you the link for this particular research paper down below in my descriptions. Okay, so this was all about this clinical study. If you like, so enjoy, right? Just keep having a hustle regarding all the clinical studies, because it's quite necessary to just have an good clinical mindset, that how much wide line of treatment, because in veterinary we don't have a demarcation that obviously you have to just use only the allopathic drug. It's not like that. If the results are getting good, what I prefer, that if the results are better from the homeopathic and the Ayurvedic drug, okay, under a short duration or a short span, then obviously prefer a homeopathic drug or an Ayurvedic drug over the allopathic, because we all know how accumulative, means obviously to a certain extent the allopathic drug do get accumulated in the body system, right? That's what we all know, have studied even in our what pharmacology and medicine, right? So that's why always prefer what I prefer, that always prefer homeopathic or the Ayurvedic medicines. If obviously if there is a serious situation where you have to just make a halt on a particular condition, so go for the allopathic. It's not like that there is a serious situation and you are just giving a homeopathic or Ayurvedic medicine, because to create a halt obviously on a particular disease, it's allopathic which is quite good, right? That's what my opinion is. So this was all about this particular canine